Good morning and adab. May I kindly request the distinguished guests to come to dais. Professor Sagupta Sahini ma'am, OST 1, and Professor Veena Washwin, the keynote speaker today. Professor Abdul Martin sir, Professor Saidam Murtaza ma'am, and Dr. K.M. Jiauddin. Kindly take a seat. The chairperson of the session, Professor Sagupta Sahini, ma'am, OST 1 of our university, MANUU, and Professor Veena Washwin, University Keynote Address, Professor Abdul Martin sir, Professor Saida Murtaza ma'am, Dean, School of Arts and Social Science, Dr. K.M. Jiauddin, Head, Department of Sociology, Seminar Convener of this international seminar, Dean, Heads, faculty members of other department, my colleagues from the Department of Sociology, my dear participants, students, and distinguished guests. I warmly welcome you for the today's program organized by Center for Women Studies, MANUU, Department of Sociology, MANUU, in collaboration with RC30, Digital Sociology, Indian Sociological Society, New Delhi. Let's begin this session with MANUU Tarana. I request engineering staff to play the MANUU Tarana.
ये बाबे शहरे इल्म है उर्दू ज़बान का, ये बाबे शहरे इल्म है उर्दू ज़बान का। आओ सफ़र यहाँ से करे आसमान का, बाबे शहरे इल्म है उर्दू ज़बान का। इल्मो कमाल फज़लो शियारो शूर तक फैली है दिल नवाज महक दूर दूर तक। मिलता यहाँ निसाब है सारे जहान का, ये बाबे शहरे इल्म है उर्दू ज़बान का, ये बाबे शहरे इल्म है उर्दू ज़बान का। हर नक्शो रंगो बू से करो अपनी गुफ्तगू, आजाद दरसगाह की है ये भी जुस्तजू। सब फासला मिटाते चलो दरमियान का, बाबे शहरे इल्म है उर्दू ज़बान का। गरबो जुनूब से होके शर्क़ो वो शुमाल से आगे बढ़ो ख्याल मिला दो ख्याल से चर्चा हो कायनात में हिंदुस्तान का बाबे शहरे इल्म है उर्दू ज़बान का फसले सदा बहार से बस्ती बसी रहे मिलकर दुआ करो कि ये खेती हरी रहे साया रहे सरों पे किसी साहिबान का आओ सफर यहाँ से करे आसमान का ये बाबे शहरे इल्म है उर्दू ज़बान का ये बाबे शहरे इल्म है उर्दू ज़बान का
Thank you. Such a beautiful tarana of our university. I think it's very beautiful. And it has written by our beloved Vice Chancellor, Professor Syed Anil Hassan sir. So let's begin with felicitation of our guests on the dais. I request Sadaf to bring the shawl. And I request Dr. K.M. Ziauddin of Department of Sociology, the convener of this seminar, to present a shawl to our Honorable West Imam. Professor Sagupta Sain Imam and Dean Ma'am also join. And once again, I request K.M. Ziauddin and to felicitate Abdul Matin Sahab. And I request Dean Ma'am to felicitate today's speaker, Professor Bina Bashwani Ma'am. And I request Dr. K.M. Ziauddin, the convener and head of the department, to felicitate our Dean Ma'am, Professor Saida Murtaza. अरे ताली तो बजना चाहिए भाई, तो बनता है. And
sorry for coming in between. I'll just take 1 minute. Professor Shahida Murtaza, the Dean School of Social Sciences, Arts and Social Sciences of Maulana Azad National Urdu University. She is also director of the Center for Women Studies. This seminar is in the honor of Professor Shahida Murtaza. For one simple reason, any student in academics will appreciate the work of your teacher, your mentor, your senior, your colleagues who has served for more than 3 decades in the area of gender studies, in the area of women studies. Professor Shahida Murtaza has been one of the individuals from our university who has represented university across the country, across the globe. And I tell you with my own experiences, last almost 19 years, I have known her not by as a colleague, by people who know her outside the university, that she has been working a lot on gender studies. And then that will make you believe that we do have people like Professor Shahida, who has contributed immensely in the area of gender studies, and also much more closely rooted to the grassroots activities. As somebody in the city will tell her as activist, somebody will tell her an academics, the other will tell you that she is a senior professor of the university. But during this process of organizing this seminar, I learned many senior professors in academia who is 70 plus years. They said, oh, you are Shahida's colleague. I know her. And then they keep telling you about Shahida. Now, the way they address, they are the senior of Professor Shahida, and she is one of our most senior and almost senior professor of the university. Please give a big applause on her contributions to the university. Ma'am, this is honor, and you have served the university. She is superannuating this month, in the month of August. So this was the right time to celebrate. And as a student who has studied in Delhi, Jamia Millia, JNU, Delhi University, where we have seen celebrating retirement of our professors by honoring a seminar, and nothing better than this. Politics of Gender, Health, and Digital Initiatives is dedicated to Professor Shahida. Thank you, one and all.
Thank you, Dr. KM Jiauddin, for kind word about our dean, beloved. Even I came to this university, Professor Manish Kumar Verma also referred Professor Saida, go and meet Professor Saida of this university. So she is well known to academia area, so all knows to him. So I request Professor Dr. KM Jiauddin, Head Department of Sociology, convener of this seminar, to welcome and discuss about, tell about the theme of this seminar.
Thank you, Dr. Vivekanand Naik, Associate Professor in my Department of Sociology, Maulana Azad National Urdu University. Indeed, it is a pleasure to have somebody like Vivek, who has always been very active and warm in taking care of any initiatives. In this 2 days program, title and theme as Politics of Gender, Health, and Digital Initiatives in India, I welcome all the guests, and let me begin with welcoming Professor Shugufta Shaheen, Officer on Special Duty, who takes care of the next to the Vice Chancellor of the Academic Affairs of the university, that you could agree come on a very short time and preside this inaugural session. Let me in absentia thanks a lot from my bottom heart and on behalf of the organizing team to the Honorable Vice Chancellor, Professor Syed Ainul Hasan Sahab, Padam Shri. He had agreed from the day one when we conceived this program. I had discussed with him, and he was very happy that you are going to organize in a very different area of research. But unfortunately, for a certain reason, some health illness last day, sir is not able to visit here, but he has passed his greetings. I also thank Professor Ishtaq Ahmed, who could not join us, and for giving all the support for organizing this program. The keynote speaker of the session, Professor Veena Vaswani, who is very, very dedicated and humble academics work in this area. She is located at Mangalore, Yennepoa University. It's one of the very powerful in the area of doing a lot of work. And I had been there a few months back where I had a chance to meet ma'am. Thank you so much for agreeing and giving your consent to deliver keynote address. She is one of the person who started Center for Ethics Research at Yennepoa University. Her academic contribution in the area of bioethicists and in the area of forensic medicines, in terms of human rights, in terms of bioethics, and locating medical law is extraordinary. Anyone who wants to see her contributions will be very happy to visit the website. We do have with us very senior professor of sociology, Professor Abdul Mateen from Aligarh Muslim University, and currently sir is serving as visiting professor at USTM Meghalaya. Professor Abdul Mateen is one such individual who has been always active. Largely, when you superannuate at the age of 65, then we feel we cannot do more. It's end of our like physical activities. But I think it's more than 5 years sir has superannuated, and I still feel that is still at 60s, traveling to Delhi, Northeast, and various parts of the country, and many publications in the last couple of years after his retirement. So I think someone who does lot of activities in terms of engaging with new areas of research. You have Professor Abdul Mateen, very much engaged into information technology, digital initiatives. And recently, there was a book which is published on digital initiatives in India. So we are very privileged to have you, sir, in this 2 days program. Welcome you. You always referred MANUU as second home. So let me quote it, that welcome to your second home at Maulana Azad National Urdu University. We had Professor Sushila Kaushik, who has been one of the founder in gender studies, but you can calculate Professor Sushila Kaushik could not travel last night. She is born in 1938, and at that age of aging, she was to travel, but her husband got sudden. He had to be admitted in hospital, and she is there to take care of him. So she could not come, but she had conveyed good wishes to all of us. I also welcome all our resource persons or invited speakers here who agreed to travel from various parts of the country. Friends, ये पूरा प्रोग्राम ऑफलाइन में होने वाला था और अभी भी ऑफलाइन में होने वाला है. सिर्फ कुछ लोगों के नहीं आने की वजह से शेड्यूल में आप देखेंगे कुछ मेहमान ऑनलाइन प्रेजेंटेशन देंगे, and they had some genuine problems, they could not travel. Otherwise, this was all offline discussions on this area. So I welcome Professor Tulsi Patel, who retired from Delhi School of Economics. She could not travel, but let me convey my heartfelt thanks that she agreed to come online, and in the next session she will be delivering. Tulsi Patel is one of the sociologists of the country who did first work on fertility behavior in Indian sociology. So you people who work in this area will recognize. We do have Parov Mishra, welcome. I welcome Dr. Sangeeta Desai, Professor Arvinder Ansari from Jamia Millia Islamia, Dr. Garima Yadav, who traveled from Switzerland, but due to some issues, she could not come yesterday. So we are arranging her online. We do have Dr. Namrata Mishra from Mumbai, Uzma, Dr. Amity Jasrotia, she is sitting here from University of Rajasthan, Dr. Rashmi Kumari from Ambedkar University, Delhi, Professor Sudha Khagote, she will be reaching, her flight is delayed in a while. We would have Srinivas Kodali, Nimisha Sindhu, Professor Pratibha Desai, Resma Samal, Dr. Sabana Keser, Sazia Chaudhary, Dr. Sazia Farooq Fazli, one of our good friends who had traveled from Aligarh Muslim University, Dr. Vishakha Jha traveling from Agra, and she has recently shifted to Telangana. So thank you so much for traveling so far, Dr. Diksha. And we have one dedicated panel tomorrow afternoon. People from Europe, they'll be joining online. I shall mention now because they have contributed and they're writing full paper for this conference. Dr. Bushra Sadiq Faisal and Professor Barbara Evans from University of Leeds. Spurti Kolipaka again from University of Leeds. We have Dr. Dareen Altavam from University of Leeds. They work in the area of wash and menstruation health. With this brief name, if I have missed out any invited guest name, please forgive me. I welcome you all in this 2 days program, along with my very dear colleagues, Professor Habib, Professor P.H. Muhammad, Dr. Saeed, Dr. Parveen Kamar, Professor Danish Moeen, Dr. Qaisar Ahmed, Dr. Khalid Parvez, and all of you, dear PhD and master students, whom I call my friends. Thank you so much for joining this program. I welcome you all in this 2 days event. I'll just take 2 more minutes to introduce you about this theme and then take my seat. This theme is very important and quite unknown to me as well. ये theme बहुत खास है, बहुत अहम है, लेकिन मेरे लिए बिल्कुल अजनबी जैसा है। और पिछले 1-2 सालों से थोड़ी बहुत कोशिश की है मैंने, क्योंकि मुझे लगा जिस दौर में हम जिंदगी गुजार रहे हैं, जिस दौर में हम सफर कर रहे हैं, हमें जरूरत इस बात की है कि नए नए मुद्दों को समझने की कोशिश करें. So I started that attempt, and I remember we had one international seminar 2 years ago, and that was the beginning that I started reading something on digital, where we had truly another international conference on digital culture, where we had people from across the globe. Therefore, the theme of politics of gender, health, and digital initiatives is very important in an era of technological development, and this doesn't separate from any learnings which we do have in social sciences. And many of us would simply refer digital sociology का काम है क्या? No, this is not digital sociology only. This is beyond any subject domain, and in the last 1 decade of India, that has witnessed a rapid expansion of digital health infrastructure, or you would say digital public health infrastructure, from Ayushman Bharat digital missions to platforms like eSanjeevani, Poshkar Tracker, and gender-based e-governance tools, and many other tools we'll be discussing. We do have learn from reproductive health to wash area, and now we have started talking about menstrual health. One of my postdoctoral students started working on menstrual health. That helped me to read more about menstrual health, but I still find myself I cannot do much on that area, considering some field issues. But yet, behind all those promises of technology we find a complex web of structural inequalities, gendered exclusions, and digital divides. While digital initiatives are often celebrated as tools of empowerment, we must ask, empowerment for whom? Many women, particularly from rural, Dalit, marginalized, and other digitally excluded communities, voiceless in decision making and overburdened by care and sanitation-related labors. Therefore, this seminar also addresses the question of policies related to digital health and gender concerns. And one would be happy to, and we have papers that will be addressing and would provide a sociological, anthropological, from socio-political perspective, intersectional and feminist lens to unpack the politics of recognition, access, and representation embedded in these health and digital reforms. In that context, let me conclude by saying one important concerns that we would also be inquiring algorithm biases. And we do have 2 papers which is mathematical in terms of the title and abstract. We do have reproductive rights and how WASH policies impact the lived experiences of women and girls in everyday India. Largely we are talking about India. So पूरे पेपर के जो उन्वानात हैं वो हिंदुस्तान के मुआशरे, हिंदुस्तानी समाज के कॉन्टेक्स्ट में है. In bringing together the large number of scholars, practitioners, activists, technologists, and people in the field, we hope as an organizer, as a learner, to foster collaborative reflections, generate policy insights, and pave the way for more inclusive and equitable digital health governance in India. Let us use this platform not only to share knowledge, but to imagine transformative futures where technology is not merely efficient, but just not merely digital, but human. Once again, I welcome you all and thank you for being part of this important dialogue, discussions for next 2 days. I'm sure और मुझे यकीन है कि हमारे तमाम तुलबा तालिबात, तमाम रिसर्च स्कॉलर्स अगले 2 दिनों तक उस भीड़ की तलाश में नहीं होंगे जिसे हम इस हॉल में भर कर देखना चाहते हैं, बल्कि उन लोगों की तलाश में होंगे जो हमारे दरमियान कुछ खास रिसर्च, कुछ खास काम करके अपने तहकीक के जरिए यहाँ आपके दरमियान आए हैं. हम उनके सेशंस को सुनेंगे और रिसर्च के डोमेन में क्या नया काम है किस तरह से नए कामों को हम टेकअप कर सकते हैं, उसके बारे में सीखने की कोशिश करेंगे। और उम्मीद है कि ये सेमिनार मानू के हमारे हिस्ट्री में, तारीख में एक ऐसे इनिशिएटिव्स को जनरेट करेगा जो डिजिटल इनिशिएटिव्स ऑन जेंडर कंसर्न्स पे पहला होगा। मैं आप तमाम का फिर से दिल से खैर मकदम करता हूँ। उम्मीद करता हूँ कि आप तमाम मेहमानों का, खास तौर से जो बाहर से आए हैं, यू एंजॉय द कैंपस, the city and beautiful weather of Hyderabad. I'm sure you will enjoy staying here. Let me thank again Professor Sugufta Shahin ma'am for coming here, gracing the inauguration. I have taken more than given time, Dr. Vivek, but I regret and I welcome you all again. Looking forward, please let us know if there are any concerns to our volunteers within this hall. Thank you all for joining. Wish you all the best for next 2 days.
Thank you, Dr. K.M. Jihadin. I always love to work under his leadership. He's a very young, enthusiastic, and I'm always happy. I welcome Professor Arvind Ansari ma'am. Please come to the front line. Okay, thank you. Now I request Professor Shahida Murtaza ma'am, Dean, School of Social Science, and Director, Center for Women's Studies, to say a few words.
Good morning, everybody. Adab. Today I'm really happy to see the youngsters relatively here as participants and contributors to the seminar. And at the outset, let me thank Sia, my kid brother. I always consider him a family, who has shouldered all the responsibility of conducting this seminar, and also for seeding the idea of thinking of going to a retired person, and in memory, you want to really commemorate something such beautiful. And I'm sure the youngsters and all the professors who have joined here will definitely contribute to the value to keep it really as memorable as possible. Coming to the topic of today's discussion, let me tell you, way back 20 years before, 2006-07, I had submitted a project on digitization of rural communities when it was not much in vogue. And today I see there is such a huge, movement around or across India. The ministry also has come out with a lot of initiatives in digitizing the whole health system. We have beautiful system, yes. Since 2015, the government of India has started digital initiatives in health system, health sector. And then we have now National Health Mission converted into or rechristened as Ayushman Bharat, health initiative. So all these things, while we read e-health about telemedicine, about Sanjeevani, about various aspects and initiatives, flagship programs जो भी initiate हुए हैं, looking at the hierarchy of our society, I feel, of course, all of you know there are divides, rural, urban, rich, poor, and then men and women. Of course, gender, again, a fluid state. I think Sia has forgotten to mention here that we are going to talk of the third gender here. So you see all these divides, or we think of the initiatives which are digital in nature. Are we really equipped? All of us, rural, remote area, जहां आज भी कई घर में इलेक्ट्रिक बल्ब नहीं जलता. How about them? The unreachable, जो पहाड़ी पे रहते हैं, जो तराई में रहते हैं, जो रिमोट एरिया में रहते हैं. Since I have quite, I think, in my 35 years of basically I'm an anthropologist, so fieldwork is my, like heart and soul. So we did. We did go to remote areas, the Lamanis, the migrants, and then the SC/STs, the Mehtar community, the marginalized. I love, that is my, I say, umbilical cord. Always I love to work with them, the downtrodden. Recently we completed study in reproductive health and the issues, SDG 5 particularly, in the rural slum areas. And I tell you, talking about so hi-fi, I mean, technological telemedicine and all that, जहाँ literacy ही नहीं है बराबर 100%. कई जगह तो women, gender divide is there. So looking at that, we need to have, I feel, a framework, legal and a comprehensive, wherein there is always possibility if you go through, and I expect you to come out with some paper on these initiatives and what is the outcome. Though it is too early to talk, since 2015 they started, but we can have an empirical feedback on that. कि किस हद तक हम कामयाब हुए हैं गवर्नमेंट ऑफ इंडिया के इस इनिशिएटिव से, कितना प्रोग्रेस किया है, क्या ये सुटेबल है, इसमें कुछ चेंजेस लाना बहुत जरूरी है, कि किस तरह से मेरा प्राइवेट डेटा जो आपने मांगा और मैंने दे दिया सेफ है, मेरे बारे में मेरी प्राइवेसी को कोई मिसयूज तो नहीं कर रहा है, कहीं गलत इस्तेमाल तो नहीं कर रहा है उसका, इसके बारे में आप मुझे क्या अश्योरेंस देंगे? So it is very essential that when we talk of digitizing the health system, it is very, very essential that certain parameters are taken care of. There should be strong regulatory mechanism, regulatory and legal mechanism, wherein you take care of my personal data. That information which I am sharing with a doctor, because you are connected, it's a very good idea. The doctors, the medical practitioners, and the patients are connected in this system. Very beautiful. The whole world is turning digital. India is also striding in that, making a lot of progress. But we have to take care of this lacunae, I shouldn't say, but there are sensitive areas. We need to really plug those loopholes. बहुत जरूरी है. मैं नहीं चाहूंगी मेरा या मेरी बच्ची का या किसी का डेटा बाहर कोई मिसयूज करे. जिस कॉन्फिडेंस से मैं डाल रही हूँ, आपके साथ शेयर कर रही हूँ, वो properly protected है कि नहीं. This is one of the greatest concern, or it needs policy change maybe. And Veena will be the bestest person to comment on ethics of digital medical technology here. And also talk of, there are two aspects maybe all of you are going to speak of. There are technical challenges, there are non-technical challenges. The speakers will come out, I'm sure about it. I don't have to take much time on that. I'm just giving a hints of. And from this platform, I really would like to thank wholeheartedly all my friends who have said labbaik to my call and to Zia's invitation and made this meeting, made this seminar very memorable. I'll be more happy when the book or journal will come in our hand. Professor Mateen will be commenting on that aspect, I'm sure about it. Thank you, Veena. Thank you, Professor Shagufta. And thank you, Mateen Saab. Thank you, Shazia, Muhammad, Amina. All of you for having, all those who are sitting, Professor Danish, Parvez, all of you who have come and made this, really speaking, a very good experience it will be after 2 days when we come out with a very endeavor aspect of health. Since I've been dealing with only reproductive health, but today we have initiated in this digital initiative also, which I said 20 years before I had initiated, but I could not complete due to lack of funds from UGC. Thank you so much.
Thank you, ma'am, for the enlightenment on how to use data and conscious about the gender. And now I invite Professor Abdul Mateen Saab, the visiting professor, USTM, Meghalaya, RC30 convener. In fact, I can say that he's the founder of that RC13, and we are always grateful to him to know about digital sociology, which is now it has come in all circle of society. Thank you, sir. Please.
Good morning, everyone. Honorable Vice Chancellor MANUU, Padam Shri Professor Syed Ainul Hassan could not turn up for the reasons beyond control. Professor Sushila Kaushik again could not turn up today for the reasons beyond control. Professor Shagufta Shaheen, OSD, Professor Shahida, Professor Veena Waswani, Dr. K.M. Ziauddin, young and energetic organizer, Dr. Naik. I'm extremely grateful to the organizers for the kind invitation to me for MANUU, which I always consider a home away from home. So I'm truly thankful for giving me this opportunity to especially giving some opening remarks. A couple of months back, I discussed with Dr. Zia and also Professor Shahida regarding this conference. And I'm happy and delighted that, we are able to have really inviting in such a big way coming from different parts of the country. I was thinking that, what to share about this conference. First of all, my interest in digital sociology is something way back in 1980s when I was exposed to the computers. Then it was not very common, at least in the developing countries. And I remember in mid-80s when Government of India wanted a supercomputer for the Government of India, Mausam Bhawan, and US denied as usual. And our university, University of Toronto, had a supercomputer, and barely 50% of supercomputer was used then, and rest 50% was sold to the Government of Ontario. So that exposure, and also, I don't know, like long story to make it short, that what you have NEP 2020 today, so-called interdisciplinary or multidisciplinary. By training, I'm a sociologist. However, my main supervisor happened to be a mathematician who himself was a student of an economist, Nobel laureate Kenneth Arrow. So this NEP 2020 and ABC 2021, which we have been talking today, I was lucky and fortunate to have that kind of exposure long back. I was lucky that my co-supervisor happened to be a student of both Talcott Parsons and Robert K. Merton, my co-supervisor W.W. Izai. Those things gave me an opportunity to rethink critically and creatively. I want to draw your attention towards three major events which all of you are well aware of. Renaissance, French Revolution, and Industrial Revolution. And as sociologists, or political scientists, or economists, or anthropologists, you all are well versed that how these three major events impacted the economy, polity, and society. The point which I want to draw attention to the especially young generation, I'm too old, that like that, something very important happened at the mid of the 20th century, and that is I call digital revolution. When I want to draw your attention towards the digital revolution, I also want to draw your attention towards the first generation computer characterized by the vacuum tubes, the second generation computer characterized by the transistors, and a paradigm shift in the third generation computer characterized by LSI and VLSI and VVLSI in the domain of hardware and software also. And finally, the 5th generation computer, where the paradigm shift was again from hardware and software to so-called AI, artificial intelligence. In this background of 5th generation computer, I want to draw your attention as a case study of NVIDIA and the contributions of Geoffrey Hinton, Nobel laureate, again from University of Toronto, and something very interesting, what we call it NEP 2020 and ABC 2021, that a person coming from psychology background at Oxford, becoming a professor of computer science at the University of Toronto, and getting Nobel Prize in physics, so-called godfather of artificial intelligence, Geoffrey Hinton. And Hinton's contribution on so-called machine learning, then deep learning and neural networking. This is something how, as a sociologist, as a social scientist, we may like to look upon. Professor Shahida ma'am has reminded us about gender. For gender, I consider J.J. Rousseau's work, that J.J. Rousseau points out about the distinction between natural inequality at the one hand and social inequality on the other hand. This is something original in the sense that people may be short or long, tall and short, or male or female. And these are natural inequalities. One may be white, others may be black. One may be a Brahmin, others may be a Shudra. But the point is that when we attach values that a black is inferior and a white is superior, a tall man is better than a shorter one, man is better than woman, patriarchal setting, so on and so forth. So this point, first advocated by J.J. Rousseau, that is something very important. So when we look at the gender from that theoretical perspective, stemming from the contribution of J.J. Rousseau and how it is relevant for today for Indian society as such, that is something we need to ponder over. There has been so much of development. Elon Musk's projects, Starlink, I was thinking about, yes, digital divide. It's a harsh reality today all over the world, including United States of America. But then, the point which I want to draw attention towards, and especially towards the young generation, that technology had been an integral part of our everyday life way back with the advent of human civilization. Maybe somewhere in Africa, when we had evolution from chimpanzee to human being. And then the use of fire as a technology, that was also important. And today, because of NVIDIA's GPU, in a kind of technological advancement in the hardware, and Geoffrey Hinton's contribution on ML, deep learning, and neural networking, all these are great contributions which we need to, as a social scientist, as a sociologist, as an economist, as a political scientist, as a psychologist, in different disciplines, so-called interdisciplinary and multidisciplinary, we need to ponder over. And I think that generations like mine, I'm too old, being a digital immigrant, and young generation, what is so-called digital natives, can do justice with these topics of how technology is shaping and reshaping the economy, the polity, the society, well documented in the writings of Manuel Castle's Information Society, spread in more than 1,100 pages. The work which is recognized and equated with Das Kapital by a living sociologist like Anthony Giddens. So the point is that how the technology is crucial in shaping and reshaping the economy, the polity, the society. And as a social scientist, our task to unravel those complexities, unpack it. And here, can we leave the technology to technologists, or there is a scope for what I call quote unquote ethical algorithm? Because we have an expert on bioethics, but then there is something called ethical algorithm. And in ethical algorithm, the crucial role which scientists, along with the engineers and the hardware specialists and the software specialists, can really contribute in the field of ethical algorithm. So these are some of the areas. Health, education, these are very important areas. And this is more important so because we know these stories, successful stories of so-called Asian tigers. Many countries in Southeast Asia, located in Southeast Asia, got independence after India's attainment of independence. Yet, they are doing much better than a country like India as such. And probably because of the most resource allocation in the domain of education and health. Singapore is one example. Korea is another example. Malaysia, and so on and so forth. We have a list long, very, very old documented ethnographic details about it. So the point is that how this digital technological revolution is impacting, what are the potentials and what are the dangers also. Like if you read Jeffrey Hinton, he's more worried, in spite of being the godfather of artificial intelligence, and who is responsible for creation of artificial intelligence by his contribution in machine learning, deep learning and neural networking, is more concerned today about artificial intelligence, the dangers which the society may encounter in time to come. So these are some of the concerns as social scientists we have to deal with. And today's this international conference, I am sure and I'm highly optimistic that we will try to contribute, we'll ponder over some of these issues, and it will be a good and great beginning to think, ponder, and contribute in the field of new era which are coming up. So with that, again, I'm extremely grateful to the organizers for giving me this opportunity to share my views on this important theme, and MANUU, Hyderabad, which I always consider home away from home. Thanks a lot indeed.
Thank you, sir, for wonderful opening remarks on evolution of technology and relationship with the society, and talked about the technology for all, and highlighted the growth of a country is based on the growth of a technology. So thank you. It was a wonderful lecture by you. Now I invite Professor Veena Vashwini, Yanapua University, to deliver a keynote address, which we all are waiting to listen.
Good morning to you all. Respected Honorable Vice Chancellor Sir, Syed Ainul Hasan Saab, Registrar Sab Professor Ishtiaq Ahmed, and Professor Shagufta Shaheen Ma'am, OSD, and our very dear Shahida, Professor Dean of CWS, Dr. Khwaja Ziauddin Saab, who is the convener of this such a prestigious, knowledgeable gathering, and also Professor Mateen, and the speakers, the chairpersons, the delegates who are here as well as who have joined online. It's an honor and responsibility to address you at this prestigious event. When Shahida called me to say, will you give a keynote, I was a bit concerned because I've always thought keynotes are a little boring compared to PPTs where you lights, camera, action, da-da-da, video. You can't do that in keynote. It's very somber affair. And a person like me, to give a keynote, had to adopt a different style of talking, and I had to be more serious. I can't afford to be flippant. So then I decided, why is she telling me this? I cannot even floor the audience, impress the audience with my good PPTs. But then I thought, this calls for some responsible way of bringing things to table. So thank you, Said. That's the first time I'm giving a keynote. So please, errors and omissions accepted. So the title of this topic, when it talks of politics of gender, health, and digital initiatives, it couldn't have been more timely. And when I look at the topic, I would like to reform it like, how do we reimagine equity? Reimagining equity in gender and ethics and AI in digital technologies. Then I would say that we are at this juncture where data is more powerful than gold. Algorithms replace the judgments and critical thinking. Digital interventions promise efficiency and smartness, but create exclusions. So I ask, who are here, who are benefited and who are rendered voiceless? Who is it that we see them as a visible persons through the technological advances? And who are those who bear the burdens of advancement? Why? Because it's an uncomfortable truth. You know, truth hurts many times. We would like to cover truth or kind of decorate truth and make it underplay the impact of truth. But the fact is, the technology is never neutral. It's not neutral because algorithms, like our policies, are shaped by values and assumptions of those who build and implement them. That means just as a crying child gets milk, the people who make policies bring in their lived experiences, and those who are not at the table are not considered. And in the last moment discussion, like we did with Delhi metros after they were inaugurated, that what was it for those physically challenged? Then you have a second thought, oh, we should have done like this, we should have done like that. But why don't you call them on the table? The same thing happens when we make policies for anybody without including them in the discussion. In a public health sphere, Ayushman Bharat, which Shahida has quoted already, digital mission, Poshan tracker, we are witnessing a government regime. The systems claim to empower, but they also monitor, sort, and exclude, and sometimes silence people who have no access to it. From gender perspectives, these initiatives must be investigated, not in mere terms of access, but in terms of agency and accountability and justice. During COVID times, post-COVID, we had a study on qualitative kind of analysis of what the transgender people in Mangalore felt were the services given during COVID. It was heart-wrenching that they were not included as a part of community discussion. They did not know whether to take vaccine or no because they had comorbid conditions. The kits that were delivered was not given because the gender that they claimed they were was not in the Aadhaar card, because those days Aadhaar card giving was not easy. So we have a huge number of people who were excluded thanks to our way of verification with Aadhaar card. I don't say it is wrong, but who is talking for those who are voiceless? And if you were to say it didn't do justice by these people, then You're not looked upon as a friend, but you're looked upon as unpatriotic person. That how dare she comment on the policies we have made so well. So that is why we need to look at the agency. We know that less than 40% of Indian women have smartphones with internet access. Much less if you include rural and tribal populations. They might even manage a mobile, but they may not have an internet data or connectivity. So what does it mean to digitally empower women while these realities are shaped by our structural barriers to access? The existing literacy gap exacerbates the privacy breach and exploitation potential. For instance, I'm world famous. I don't say it out of arrogance, but the world has proved me by making calls from different countries. People confirm that I am technically challenged. So they call me to say, click this link and you lose money. They call me, say, do this and I lose money. So it's almost like world over people know you call this number and there is one nerd who's going to do this. Including when you get a call saying that there is 10 grams of MDMA on your name in Bangkok and your Aadhaar card is attached to it, and so you better come on Skype and apologize. These are the calls I receive. Of course, I have not fallen prey to it so far, but it's just a matter of time when I could have been easily, and I know a bunch of them who are already a prey to it. So just making them digital savvy, does it give them protection from exploitation? Digital divide has an impact on health outcomes. We talk of telemedicines, but then if you don't have an access to a smartphone, then how can you even get a telemedicine services? During COVID vaccination, I shall narrate an instance where a group of my transgender friends, through our discussion, told me that they were asked to go for COVID vaccination. All they were asking was information. We have diabetes, we have hypertension, we are on hormonal treatment, we have done this, should we still take it? No asking, just go, because you're a threat. So they were bundled up. There was one person who was using his smartphone to get for 5 people a first dose of COVID vaccine. After that came the second dose. This person was missing. They could not get second dose because you need to get an OTP on the first one and not otherwise. Technology is fine, but those who can handle it. But there should also be a method for those who cannot. So you cannot have a technology without a human in the loop. There's no way saying it doesn't permit, what can we do? So we should be careful of what kind of technology we are promising equity or equality with, because data bias due to gender, especially when you have a digital health platforms, when it is gender blind, it gives rise to a lot of implication on a woman's health. It perpetuates inequities. Our main battleground, especially in gender, is in water, sanitation, and hygiene. Policies like Swachh Bharat Abhiyan showcasing a national pride. Yet, if someone was to do a research, which they've already done, and proves the access and where is the gap, it is not taken kindly. There are still women who are young girls who drop out from schools, and then they still use a toilet outdoor where they are subjected to indignity and even sexual exploitation. Transgender individuals often find no category because from a hospital point of view, there was a doctor who was inquiring with me what to do because the ART, antiretroviral therapy, if you want to give it to a person transgender, then you have only male-female category. How can you just make a category non-existent? We can do it because of arrogance of knowledge. It's called the epistemology, the basis of knowledge. What we know is truth. What we don't know doesn't exist. And this is how we have been treating with people, with minorities, with castes and subcastes and religious minorities and gender minorities. So it's high time that we made space for everybody. And you don't have to think of rocket science, but the basic human right that all human beings, male, female, transgender, lesbian, gay, bisexual, homosexual, or intersex, or LGBTQA++ spectrum of genders, they're all equal. Is it such a difficult thing to accept it both in brain and heart? Some people accept it in heart, so we'll do everything, but when it comes to working out into policies, it falls short of it. The politics of visibility. Many a times, we complain that there aren't enough bus shelters, and we make a representation and we immediately have a beautiful bus shelter built. But have we thought, what about those people who don't have a roof over their head, who have attached huts on which the water, through which the water leaks? What about them? But their voices are not heard, you see. That representation we, the strong ones, can make, and we do for what it's really important to us. So what is counted is not always what matters. And what matters most is not always counted. So the policies don't always address the needs of the people. And in patriarchal norms, men's health over women, boys over girls, even representation in decision-making processes, policies, we don't have 30% representation. But how many politicians have fed pedas and said, we will make 30, we will make it 30, clap, 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 photographs, everything is taken. But it doesn't work out. It is not at that level. It is just at the level of gathering votes. Intersectionalities, marginalized groups face compounded vulnerabilities. Young girls assaulted, violated, they bear the burden, especially of justice, because even the FIR is not registered. We look at the Bharatiya Nyaya Samhita, the rape on the transgender doesn't get the same serious punishment as a rape on a cisgender. So the vulnerabilities continue because the question of if you don't register a complaint, where is the question of taking you to court and giving justice? And AI, especially in healthcare, sounds very promising today. I come from a deemed university, medical college, hospital. We almost have a technological imperative. If there is a technology, hospital must have it. But we also must know, despite its promise of predictive testing, resource optimization, automatic triage, you name it and we have it. But the algorithms come from a biased data. Data sets reflect predominantly male urban upper class population or even women from upper class population. How many of you think that the CHCs, community health centers, the peripheral health center, PHCs, have got computer with internet so that they can give the data? They're still into the manual way of writing and scribbling, and that healthcare doesn't translate into an effective algorithm. So what we get data is not representative of pan-India. AI systems, that is how, misdiagnose, misrepresent symptoms of women, Dalits, and queer lives. Especially if you have a rural lady who has not come for an antenatal pregnancy, it is very easy to label her as high risk. Because that is how the algorithms are built. So the question then is, how do we make the healthcare equity? Because without stigmatizing them. Then comes the surveillance, biometric tracking of ASHA workers, facial recognition, especially at airports they have failed. Facial recognition works well only for white-skinned, and they don't work well for black and brown skin. So in some countries, you see a huge lineup of black and brown singled out because facial recognition is not working. You start feeling everybody's looking at you. Oh, is she the one or the imposter? So automatically you feel stigmatized. It's not your fault. So when we expand these boundaries without an ethical inquiry, so it does not result in justice. Privacy is deeply gendered. It's a woman's reproductive data that is shared. Its autonomy is violated even without her knowledge. Disparities in healthcare access due to mobility restriction, maternal mortality, nutritional anemias, which are at the grassroots level, are not always captured, and the domestic violence and mental illnesses. So, am I only complaining and cribbing, or do I even have any solution to talk about? And I think that we should stop treating digital interventions as technology fixes. They are there, but we should be very wary. How many of us in 1985, I think, when ultrasonography first came in India, knew of the male-female ratio? For 1,000 boys, there were 960 girls. And in the state of Punjab, in 20 years, for 1,000 boys, it literally came down to 915. So who imagined that a simple ultrasonography could give rise to female feticide, eliminating 80,000 fetuses per year, equivalent to female fetus genocide, not just feticide. It's like a war against women when they're born. Who imagined that? So who thinks of the technology? What are the ethical outcomes to come? And how would they flow out in later on terms? Do we even have a patience to wait and see? Or we just have to catch the technology wagon and be off with it and then say who are deprived of it, we can't help it, there's nothing we can do about it. So technology that does not stand on social fabric is no fix at all. Embrace intersectionality as a design principle and not as an exception. So you don't make your policies and then think, oh, let's give something to them, let's put them. They're not at the tail piecers. AI tools have to be co-created with community. It's like we had a nice transgender people slogan, not about us without us. So if we are doing about the community, they also have to be co-creators in this, and you use them and we take their inputs as to how they want their data to be captured, stored, and distributed and used. But we do nothing of the sort. In the Havasupai tribes in Alaska, indigenous people, they're very closed community. Some American scientists, ethnographers went to do a research on them. They told them, we are just doing on your blood group, diabetes, why it is increasing. But they ended up doing their genetic linkages. And only one graduate from the school was, and everybody condemned him and said, oh, you're Havasupai, you say that you have descended from sun, nothing doing. You're just from here itself. Because the entire culture was denigrated. Their way of marriages within community was, people laughed at them. So ultimately, what did the science do to them? So we do not just insist on data security, but we also on data justice. Like Professor Mateen was saying, the algorithms also have to be very ethical. So data justice, giving communities control over how data should be collected, stored, used, and transparency in algorithmic decision making, particularly how it affects the access to care, and build ethics into core of innovation. Don't look at it as in the end, do some ethical, okay, we have followed the Helsinki principle, we have followed this principle. No, it should be the core and not just a checkbox to check. Because an ethical AI should have a participatory design, especially when you talk of communities, they should be in the participation, responsible data governance, and a redressal mechanism for harm. Many a times it causes harm. It's not just beneficence, but somebody should take responsibility for this. Despite, I see a lot of hope in the room today because the grassroots workers, especially giving an example of ASHA workers who use digital terrain even in the COVID times, scholarships of feminist technologists who decolonize algorithms, and especially the women's communities who have come forward to stick their neck. Resilience of people to spring back to action, including that of the transgender people. The kind of attitude we show to them, but the resilience with which they reciprocate, come back. It doesn't mean we should overuse their resilience, but it's also time we start respecting them as equal partners. And here we are, not only to critique, but to co-create technology that listens, policies that empower, and data systems that heal and not harm. So to conclude, the future of digital health and governance in India must be intersectional, must be feminist, must be ethical. Whenever we think of feminist, people say because it's fashionable, trendy. No, because that is justice. That is a just and a fair way to do it. Let this seminar be a space for reflection, rigorous scholarship rooted in action. Let's be the architects of equitable digital future, working from grassroots level upwards. Let each of us be the leaders and be the change that we want to see through our leadership. Thank you once again for giving me the opportunity. I think I overstepped my time. I'm sorry about that.
Thank you, ma'am. It was an outstanding lecture on this seminar, and what we expect, we got it. And thank you. In your lecture, you talked about gender divide, gender justice, digital justice, and also talked about the digital exclusion, accessibility, availability, affordability, and the voice of marginal community and the gender divide. Thank you. Such a wonderful lecture. We are lucky to hear lecture. Now I invite the president of this session, Professor Sagupta Sahini ma'am, our beloved OSD one. Always we love to listen your words, and who is always help us and always stand by us. Please, ma'am.
Good morning, Assalamu alaikum. I think any other invitation, I may have made an excuse, but this is an invitation, I think, which is very, very important, because I'm also a part of this Women's Studies Department and Center for Women's Studies. So there is no scope for me to say no for this invitation, though it was belated, but I accepted wholeheartedly because I want to be a part of all that is happening today in terms of matters that are related to women. I would also like to begin by appreciating the department and the center for framing the theme of this today's conference, because this inclusive terminology is significant because it moves beyond a binary restriction that we always associate when we talk about gender. So because it is an inclusive term and because it offers open space for expansive discourse of diverse identities and experiences. So once again, I congratulate the department and the center for such an inclusive terminology that they have used for the conference. But however, on reflecting on the theme again, in terms of the politics of gender, especially with reference to health and digital initiative, I am prompted to ask whether the term gender is understood solely in terms of identity, or the framework extends to ways in which health and digital divide are themselves gendered and politicized. So when you're talking about health and digital initiatives, are we studying them only through the lens of gender, or are we looking for a more inclusive discourse during this conference that you will all be deliberating upon? Health and digital initiatives are not just neutral or technical terms, but are intersected by structural axes of power, particularly gender and class. I'm here reminded because I represent the Department of English. Naturally, I would bring in a lot of theories that we teach students, especially with reference to Spivak here. So, can the subaltern speak? Is the subaltern speaking? Are the policies framed so as to allow the subaltern to speak? So these are various questions that come to our mind when you're talking about gender and you're talking about and extending it to health and the digital initiative. So it becomes very imperative for us to understand the infrastructure related to health and the digital initiatives are whether they are accessible only to women who represent the socially privileged class in terms of education, in terms of urban residents, in terms of class, caste, or do they extend to others who do not have access to any of these important necessities of life. It is also important to ensure such interventions and policies, whether they are reaching the marginalized section who are less equipped due to the systematic barriers of class, caste, gender, and power dynamics and education. In this context, I noticed that most of us who are present here represent the socially privileged class, in terms of class, in terms of education, in terms of rural, in terms of urban residents. So we represent a class which is different, but we are speaking for them. So we need to provide access and a voice to those who are less privileged in terms of all these markers which identify the socially privileged class. So how long is it that we are going to speak for them? And again, I draw my similes, my metaphors from literature. When we started reading literature, I quote here again Virginia Woolf, when she visits the library and she sees that hardly any book written by women writers were there in the library till the 18th century, then she comes to the conclusion that there were hardly any women writing at the time, and it is only men who are writing. So how long in this context do we speak for them? There is a need for a strategic essentialism when all women come under one umbrella and allow and make policies inclusive so that everyone, no matter which class, no matter whether literate, no matter rural, can speak for themselves and are included in the policies that affect them. We also need to understand here then who are the policy makers, who is being prioritized in making these policies, and who are being excluded. And this policy of exclusion and prioritization, is it legitimate, is it conscious, or is it unconscious? So unless and until we make ourselves a part of these policy making and start becoming inclusive, it would be impossible to live in a society which is based on equity and just and fair society. I'm also here very happy to notice that there are so many men who are attending this seminar, because in today's world also, we get questions as to why are men interested in topics related to women. It is shocking to note, but then in this world, there are educated men who pose this question, which still continues to shock us as to why they are so very much interested, and they see a very biased purpose for this, for this kind of a participation. So I'm very happy that all of you today are making it an integral part of your life. I'm also very, very happy to notice that the keynote speaker of today's conference is somebody who represents the medical field, because today we are moving towards an interdisciplinary area where we are talking about removing all barriers between all disciplines. So it is no longer a very insular kind of education that we are looking forward to, but we are talking about, medical science and literature, medical science and sociology, medical science and women studies. So we are thinking of a more inclusive academia without all these barriers between us. And in terms of a very interesting department which the keynote speaker represents today, I'm sure that the forensic examination that is done to the human body is just not limited to the human body, but needs to be applied to literature. When we do a critical character analysis of a person psychologically, we do a forensic examination of that character. And we are talking about the structural processes that are involved. We need also to do a forensic examination of what goes into the process of those policy making. So forensic science is not just limited to medical sciences, but can be extended to forensic examination of truth in law, forensic examination of justice that we need to think and analyze. So we are not limiting any subject to its boundaries, but are extending it to all. So more, I think, do I have time, Shahida ma'am?
Yeah, of course, please take 5 more minutes.
Yeah. So I look forward to a further collaboration, because the collaboration with sociology is not just with women's studies, is not just because they represent the same school, but as we all understand that women's studies and sociology are closely related to one another, because it is women being a part of society. Sociology, I'm sure, owe it to women's studies department to include them in all their subjects. Actually, I am all the time, persuading the social work department to do a conference with literature, because the main purpose of literature is, spreading the social message. So we need to move beyond this, limited, what I would say call a feministic agenda, and move towards a more holistic and humanistic world, where irrespective of these binaries of gender, we need to move towards a more expansive and humanistic society. Thank you.
Thank you, ma'am, for the remark. And we are all included, not excluded. All the disciplines are with us. So now I request Dr. K.M. Ziauddin to give a formal vote of thanks, because he worked hard. Last 1 month I have seen he was always busy with even the poster is very beautiful, and all the work he has done wonderful. So I request him.
Thank you so much, Dr. Vivek, for taking this initiative for the entire session. So let me thank you for wonderfully coordinating, timely finishing this session. And on behalf of the Center for Women Studies and Department of Sociology, including RC30 Digital Sociology of Indian Sociological Society, let me thank everyone who is here in this hall and who are far distant joining online for giving your consent, time, and agreeing to contribute for this very important seminar on politics of gender health and digital initiatives in India. In fact, quite often we call it India has seen a dream of digital society, but how far that digital society is going to be useful, we'll be deliberating here. मैं अपने यूनिवर्सिटी के वाइस चांसलर प्रोफेसर सैयद ऐनुल हसन साहब का बेहद शुक्रगुजार हूँ कि उन्होंने इस कॉन्फ्रेंस को शुरू से आखिर तक ऑर्गेनाइज करने में हर तरह की मदद दी, और गेस्ट हाउस के तमाम वेविंग चार्जेस भी हमें नहीं देना पड़ रहा है. He has waived off all those things. So with a very limited resource, we could organize such a very important seminar, including the registrar of the university, Professor Syed Ishtiaq Ahmed Saab, and his entire team of the administrations for giving quick approvals, because this was really quickly organized. During vacations, I was, for some university works, forced to stay in the campus. And meanwhile, related to some work, I had to meet Professor Shahida as a dean for some discussions. And things came up, and this is the time when suddenly it was planned, and we had to move them. So within short period of time, almost 30 resource persons or contributors agreed to ride and travel to Hyderabad. All of them could not travel because of many reasons. Then last 3 days, there had been many cancellations of tickets. But let me thank Professor Shagufta Shaheen ma'am, OSD 1, Maulana Azad National Urdu Institute, for presiding the sessions and being with us all the time. And I respect your all suggestions. We do work quite open. Department of Sociology is always open to collaborate with the departments that works in the similar area of domain, and wherever we find it is much more related to us. Definitely, it is always a difficult task to collaborate. It is a challenge to collaborate with anyone in terms of academic collaborations, because you have to come to a very common platform. But then we enjoy doing those programs. Let me also thank the invited guest, Professor Abdul Mateen Sahab, for opening this theme and giving a 200 years of history of computer sciences and how we learn ethical algorithm. That is very important for us. Professor Veena Vaswani quickly locating how the challenges that policy should take care of, largely in the area of ethics, technology, and inclusive from a feminist perspective, which was very interesting to me. That how do we make policies much more feminist? Because people do not want to be feminist in terms of their approach. So policy is one that can make us very, thinking about the whole idea of politics of gender and health digital. We do have also chairpersons of the next 2 days sessions. I welcome all of you here in this hall, Professor Anurekha Chariwal from University of Hyderabad, Professor Amirullah Khan Sahab from Telangana Public Service Commission, and he is always there for any support, academic encouragement. We do have Professor Madhuri from University of Hyderabad, Professor Vindhya from TISS Hyderabad, Professor Aparna Rayapurol from University of Hyderabad, and Ms. Anju Arora, founder of Nari Wellness Initiatives. They are the chairpersons. I welcome you and also thank you all for agreeing to chair different sessions next 2 days. Friends, let me also thank all the research scholars for joining this conference. In terms of academic collaborations, you all have to learn, you all have to be part of that. So thank you all for being and sitting here. The contributors list are quite long, so please forgive me. In terms of the resource person invited speakers, there are almost 28 who are going to give these presentations, but Department of Sociology and Center for Women Studies feels proud to have these initiatives, and I thank my colleagues in the department and Department of Women Education. Largely there is a confusion outside that we do have Department of Women Education or Center for Women Studies. We have both. We have Center for Women Studies, which is a research center dedicated doing work in this area, and this is a collaboration. We do have Department of Women Education, and I thank Professor Amina, Dr. Parveen Kamar and Dr. Sabana for giving all the support, being around. My colleague, Dr. Saeed, Dr. Ihtisham, Dr. Hilal, who just left for MANUU Law School, and Dr. Vivekanand for taking care of all this stuff. And let me also welcome Professor Sheila Suryanarayan for being here, and also thanking you for agreeing to chair the session. Yeah, I named. I called Professor Vindhya. Yeah, thank you, ma'am, for being there. This is also very important to announce that the seminar purpose was not to just invite, that we are, as the mandate of the university, we are going to come up with a special volume on this theme. So I request and thank all the contributors that you have agreed, and we will be publishing this in a special volume. Many of the young researchers have requested not to go for edited volume, because I had already spoken to Springer, but with the demand of the young researcher and faculty that we should go for a journal special volume. Professor Mateen has already agreed to come up with a special volume. I have also spoken to the president of Indian Sociological Society if she can help us for sociological bulletin, but this is not done. I'm still with the discussion with them. If they agree, nothing better than that. But I'm sure that this conference will come up with a very important, very significant volume on the theme of politics of gender, health and digital initiatives in India. All the support staff from instructional media centers, तमाम हमारे साथी IMC के, आप सबका बहुत बहुत शुक्रिया. Basit from engineering, guest house manager is always very helpful, because whether we have program or not, our guests are always there in the university guest house. So I thank Sai and Razak especially, because on a single phone call they arrange all the hospitality. So let me mention them. My research scholars team who have been taking this last 1 week. So थैंक यू ऑल. आप लोगों का नाम नहीं ले पा रहा हूँ, बहुत बड़ी तादाद है आपकी, लेकिन आप सबका बहुत शुक्रिया. ये आपका प्रोग्राम था और आपने बहुत बखूबी इस प्रोग्राम को निभाया है। उम्मीद है इस तरह के प्रोग्राम आप आगे करते रहेंगे ताकि यूनिवर्सिटी का नाम और आपकी एक्टिविटीज दुनिया में दिखते रहे। आखिर में मैं प्रोफेसर शाहिदा मैम का बेहद शुक्रगुजार हूं कि आपने इस तरह के थीम को ऑर्गेनाइज करने में मेरी मदद की, क्योंकि मदद इसलिए है कि 8-10 साल पहले मुझे एक प्रोजेक्ट मिली थी रिप्रोडक्टिव हेल्थ से रिलेटेड, और मैंने थोड़े दिनों बाद उसे विथड्रॉ कर लिया था ICSR, बिकॉज आई थॉट मैं फील्ड वर्क नहीं कर पाऊंगा। आई वाज फीलिंग वेरी डिफिकल्ट एंड आई हैड टू विथड्रॉ फ्रॉम डूइंग दैट प्रोजेक्ट, बट at least at this age now we need to do some more research and from this perspective. So thanking you for trusting, and with all humility I tried my best that this program comes to a level where we can publish a volume on this. Lastly, I thank all of you sitting here, our guests. Thank you so much for traveling from Delhi, Aligarh, Mumbai, Agra, and Mangalore and many other cities. Friends from some of the European countries, because of the Iran, that war, they had to cancel their tickets then, and then plan was Barsek. So they are joining online, but they will be there and writing this paper. So I thank you all in absentia that you agreed to contribute from University of Leeds, University of Lausanne and other universities. Thank you so much. Thank you so much. I have taken a little more time, but please forgive me, and we move to conclude the session. Yeah. Thank you so much. And Mateen Sahab, I would need your more support after the conference in terms of doing this publication and everything. Thank you so much. You have always been very helpful to anyone who is from Maulana Azad National Urdu University in terms of guiding and academically encouraging. Thank you so much. Now we conclude this inaugural session. We are slightly late, sorry for that, and I request all of you to rise there and have national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता, पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा, विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा, तव शुभ नामे जागे तव शुभ आशीष मांगे, गाहे तव जय गाथा, जन गण मंगलदायक जय हे भारत भाग्य विधाता, जय हे जय हे जय हे जय 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 हे।
Thank you. All are invited for cup of tea outside of this hall.
So we will come back in 5 minutes if I am not